If you are over 70, there are 6 hygiene mistakes you may be making without even realizing it. And one of them is so ordinary that most people never think twice about it. The surprising part is that these are not the obvious hygiene mistakes you might expect. One involves a tiny part of your body that people routinely forget to clean properly. Another involves something you touch dozens of times a day, and one involves something that stays against your skin for hours, yet very few people ever stop to ask themselves whether they are cleaning it often enough. Here is what makes these mistakes so easy to miss. They don't necessarily look dirty, they don't always smell bad, and you may have been doing them the same way for years. But over time, sweat, body oils, dead skin, moisture, and everyday buildup can collect in places and on objects you rarely think about. And if you're over 70, your skin can become more delicate and sensitive, which makes these small habits worth paying attention to. So stay with me until number 6, because the final mistake is one that many people completely overlook, especially because they assume if it doesn't look dirty, it must be clean. Before we continue, tell me honestly, as you're watching this right now, is there already a little voice in the back of your mind saying, "Wait, is it that one?" Whatever you're thinking of, don't say it yet. Keep that thought in your mind, because I'm going to show you all 6, and by the time we reach number 6, you may realize that one very ordinary part of your daily routine deserves a second look. I'm Dr. Everett Cole, and over the years, I've learned that some of the simplest health habits are the ones people are most likely to overlook. As we get older, a few things can change quietly in the background. Our skin can become more delicate and more prone to dryness and irritation. Certain movements can become less comfortable, making some areas of the body harder to reach. And everyday objects, the things we touch, wear, and sleep on, can stay in contact with our bodies for hours without us giving them much thought. So, I want to be clear about something before we begin. Good hygiene after 70 is not about being obsessive. It's not about scrubbing harder, using harsh products, or worrying about every little thing. It's about paying attention to the small details that are incredibly easy to forget, especially the ones that don't look dirty, don't smell unusual, and don't seem important until they become a problem. And that's exactly what we're going to look at today. Let's go through all 6, one at a time. And as we go, I want you to ask yourself one simple question. Am I doing this without even realizing it? Number 1. Not cleaning your belly button properly. Here's the first one, and it surprises almost everyone. The belly button is a small, recessed area, and because of its shape, it naturally collects sweat, dead skin, body oils, lint, and everyday debris. Here's what most people miss. Many people wash their entire body every day and still forget this tiny area completely. It gets rinsed with soapy water in passing, but rarely actually cleaned, and because you can't easily see inside it, you may not even realize how much has built up there over time. Now, to be clear, this buildup doesn't automatically cause a serious illness, but it can contribute to unpleasant odor, mild irritation, trapped moisture, and in some people, bacterial or fungal overgrowth or local inflammation. The fix is simple. Clean the area gently with mild soap and water during your regular shower. Rinse it properly, and this part matters. Dry it thoroughly afterward. Avoid aggressive scrubbing, and never insert objects deeply into the area to dig it out. But if you think that's the hygiene mistake most people over 70 overlook, wait until you hear what happens to the object you touch dozens of times every single day. Number 2. Never washing your hairbrush. Think about your hairbrush for a second. When was the last time you actually washed it? Hairbrushes quietly collect loose hair, scalp oils, dead skin, styling product residue, and ordinary household dust, layer after layer, week after week. Here's the part that catches people off guard. You may wash your hair carefully every day, and then run a brush through that clean hair with a brush that has been collecting yesterday's and last week's oils and debris the entire time. Over time, an unwashed brush can contribute to buildup on the scalp, and for some people, irritation. The fix takes only a few minutes. Remove trapped hair regularly and wash the brush itself according to its material. And the manufacturer's instructions, most bristled brushes, can simply be soaked and rinsed. And now we move from something sitting on your head to something you probably touch more times than you realize every single day. Number 3. Never cleaning your phone screen. This one tends to hit close to home for almost everyone watching. Your phone travels with you everywhere. It's in your hands, then your pocket, then on the table, then the kitchen counter, then back in your hands again. Think about where your phone has been today. Now, think about how often that same phone comes close to your face. I'm not telling you your phone is dangerous. That would be an exaggeration. But regular cleaning can meaningfully reduce the everyday grime and surface contamination that naturally accumulates on something handled that often. The fix: follow your phone manufacturer's cleaning guidance, use a slightly damp microfiber cloth or the cleaning method they recommend, and avoid letting any liquid get into the openings or ports. But your phone is not the only everyday object people forget. There is something in your bedroom that spends hours against your skin while you sleep. Number 4. Not washing bed sheets regularly. Let's talk about your bed for a moment. Every night, your sheets quietly absorb sweat, body oils, dead skin cells, dust, and general skin debris for 7 or 8 hours at a stretch. Here's a scenario worth thinking about. Picture someone who showers every night before bed, does everything right on the surface, and still wakes up morning after morning against the same layer of accumulated sweat and oils, simply because the sheets themselves haven't been washed in weeks. It's not that they're careless. It's just a habit that quietly slipped. For those of us over 70, this matters less as a dramatic health risk and more as a matter of comfort and skin health. Washing sheets regularly makes a real difference, and it becomes even more important during heavy sweating, illness, incontinence, or any skin irritation. And if you sleep with a pet, sweat heavily at night, or spend extra time in bed during the day, your washing routine may need to be more frequent than you currently assume. Now we get to one of the most underestimated hygiene mistakes, because almost everyone uses it, and almost everyone assumes using it repeatedly is completely harmless. If you're finding yourself thinking, "I actually do that," stay with me. Because the final 2 mistakes are the ones I especially want people over 70 to hear. And if you appreciate practical health information like this, go ahead and subscribe to the channel. I regularly cover the small, everyday habits that are easy to overlook, but genuinely worth paying attention to. Now, let's continue. Number 5. Reusing towels. Too many times. Towels feel clean. That's exactly what makes this one tricky. A towel absorbs moisture, sweat, skin oils, and dead skin cells every single time you use it. And if it stays damp for long periods between uses, it can become an environment where microorganisms have the chance to multiply. Here's the part people often forget. A towel can look perfectly clean while still being damp underneath and carrying yesterday's moisture and skin debris. The fix is straightforward. Let towels dry completely between uses, rather than folding them up while still damp. Wash them regularly. Don't share personal towels with others. And increase how often you wash them if you're sick, sweating heavily, or dealing with any skin issue. But number 6 is different. This is something many women wear directly against their skin for hours. And one of the most commonly ignored questions is simply, how often should it actually be washed? Number 6. Not washing your bra regularly. If you wear a bra, be honest with yourself for a moment. How many wears go by before it finally makes it into the laundry? This is one of those hygiene questions people rarely discuss out loud, even though the fabric sits directly against the skin for hours at a time, day after day. A bra can quietly accumulate sweat, body oils, skin cells, deodorant residue, and bacteria that naturally live on the skin. Wearing the same one repeatedly, without washing it, can contribute to odor, irritation, and skin problems for some people, particularly when sweat and moisture are involved. And here's what makes this mistake so easy to miss. The bra may not actually look dirty. We tend to judge cleanliness with our eyes, but fabric can absorb sweat and body oils long before it ever looks visibly soiled. So ask yourself, when was the last time you actually washed the bra you're wearing most often right now? There's no single rule that fits everyone here. How often you should wash depends on how much you sweat, your activity level, skin sensitivity, your climate, and the specific garment. A good general approach is to rotate between a few bras, rather than wearing the same one continuously. Let each one air out between wears, and follow the care label when it's time to wash. Let's bring it all together, quickly. The belly button you forget to clean. The hairbrush carrying weeks of buildup. the phone touching your hands and face all day long, the bed sheets collecting sweat and skin debris overnight, the towel staying damp between uses, and the bra that may be worn repeatedly simply because it doesn't look dirty. Now, before you go, I want to leave you with something important. None of these mistakes means that you are automatically going to become sick. That is not what I want you to take away from this video. The lesson is much simpler. As we get older, small hygiene habits deserve a little more attention, because our skin can become more sensitive, and our everyday routines can quietly shift without us noticing. If you ever notice a persistent rash, unexplained itching, redness, swelling, pain, unusual discharge, sores, or anything that looks like it could be an infection, don't try to handle it on your own. Speak with a healthcare professional. Those are the moments where a second opinion matters far more than anything you'll hear in a video. Now I want you to be completely honest with me. Which of these 6 mistakes surprised you the most? And which one are you going to change first? Write the number in the comments. I read your responses, because your comment may help someone else realize something they've been overlooking too. Take care of the small things, because sometimes the habits that seem too ordinary to matter are exactly the ones worth paying attention to.